Dr. Mary Dillon, an anesthesiologist, and I'm going to read you a book today called Let's Meet a Doctor. The first chapter is the youngest patients. Our class is on a mission. We want to find out what a doctor does. We decide to talk to Dr. Zambil. He's a pediatrician. That's a doctor who treats children. I help kids feel their best, he says. How do you do that? Asked Jaden. Dr. Zambil explains by telling us about his day. Dr. Zambil works in a clinic. He sees about 20 patients a day. They are babies, children, and teenagers. Some are sick and hurt. I find out what's wrong, he says. They may need some medicine. They may need to rest. Sometimes they need to go to the hospital. JJ raises his hand. I went to the hospital when I was little, but I'm better now. Good, Dr. Zambil says. That's our goal. We want you to be healthy so you can reach your goals too. My goal is to be a tightrope walker, Nick says. Uh-oh, Dr. Zambil says. All right, chapter 2, checkups. I went to the doctor when I wasn't sick, Katya says. That's good, Dr. Zambil says. Kids should see a doctor once a year for checkups. He checks their ears, he listens to their heart, he asks if they eat healthy food, he asks if they run around. These things help kids stay well. Do you give kids shots? Paul asks. Nurses do, Dr. Zambil says. They took classes. They know how to make the shots hurt less. All right, chapter 3 is doctor school. Do you have to take classes too? Asked Paul. Yes, lots of them, Dr. Zambil says. We learn that Dr. Zambil went to grade school for 9 years, high school for 4 years, and college for 4 years. Then he had medical school and training for 7 years. That's 24 years of school and a lot of homework. When I'm not at the clinic, I teach, Dr. Zambil says. Like Mrs. Nugent, we say, looking at our teacher, yes, but I don't teach in a classroom, he says. I teach at the hospital. My students learn to be doctors by seeing real patients. Lainey raises her hand. I was a real patient. I went to the hospital when I broke my arm. You probably had an X-ray, Dr. Zambil holds up one right here. We all want to tell Dr. Zambil about our injuries, but he has to go see patients, and we have to go to recess. Running around keeps us healthy. Because Dr. Zambil lends a hand to help us feel our best, we give him a hand. I think that's it. Thanks for listening and stay healthy.